In 2019, only 10% of the population had ever used telemedicine for their medical care. Well, COVID-19 changed a lot of that. Now, an estimated 1 billion people will have a telemedicine appointment by the end of 2020. Seeing a doctor virtually is still a very new experience for most, so we're going to discuss some do's and don'ts of telemedicine. Dr. Tong is joining us today via Zoom. He's the Chief Medical Officer for Doctor on Demand, the nation's leading virtual care provider. Welcome, Dr. Tong.
Hey, thanks for having me, Dr. Smith. Appreciate it.
So how quickly did you see a spike in requests for these online doctor's appointments once the pandemic began?
Within the first 2 weeks, we actually saw a 50% increase in demand for our visits. So that's over what we had forecasted. By the time we were 4 weeks into this, we were almost 3x what we had forecasted for our visits. Wow. At that time of the year.
And we know that people are still getting used to having a medical appointment done virtually rather than in the office. So walk us through some of the do's and don'ts for those who haven't done this before and maybe a little nervous about it.
I think it's very important to make yourself comfortable. So, you're in your home, ideally. You're in a private location where the doctor can hear you and you can hear the doctor, but no one else that you don't want to hear that exchange can hear. So if you're in a private place, that's important. The other one I would say is, wearing a shirt or making sure you're clothed from the waist up. As we all know on video, it's a good idea. You would be surprised, but the first thing that a doctor who's never met you before, if you've got a pimple on your backside, that's not what they want to see as the first thing that they when they meet you for the first time on the screen. So on the don't side, I would say don't drive. I mean, we have people who are driving their car. It's not safe. It's not responsible. So I'd say try to avoid that. Also, don't be disrespectful or try to self-diagnose too early. You're having access to a board-certified professional. That person will be able to guide you through the visit and establish that relationship. And that's all going to be very important to getting to the right outcome, the correct diagnosis. And so I would just say, if you can follow those simple do's and don'ts, you're likely to have an outstanding visit.
Awesome. Well, listen, we're in the middle of a pandemic, of course, with COVID. So what exactly are you telling people via telemedicine who think that they actually might have it?
So what we did at the very beginning, we actually launched a risk assessment tool. And this is free to anyone on the app. They can go and take the risk assessment. And what we're doing with that is we're using that to help us identify who's at mild risk, who's at moderate risk, and then who's actually at high risk. And so we really want to see those moderate to high risk people first. And so we want to actually expedite them to being able to have a visit. Once they're in with the doctor is then going to make sure of a few things. One, is this a medical emergency? Does this person need immediate in-person medical attention, or are they appropriate for a virtual visit? They're also going to conduct the visit with questions and answers so that they're able to make a diagnosis, because COVID-19 all began at the end of flu season. We are about to be at the beginning of flu season again, and so it's really important to get an accurate diagnosis.
How do you tell the difference between someone having a cold or a flu or COVID or even a combination of the three via a telemedicine appointment?
Well, I would say that there's a lot of overlap in the symptoms between flu and COVID. But one of the first things that you can look for or think about with flu is that it comes on very rapidly. So people often will say they felt like they got hit by a truck, or they were fine one day and then all of a sudden they felt very sick. They will often have more systemic illness. So it means every part of the body feels achy. They may have muscle aches or joint aches. And so those are also very common. Now, the overlap occurs between the two with cough and fever co-occurring, and that can happen in both illnesses. But with COVID-19, there's some really specific features of the cough. One is that the cough is dry often. So you don't have all of this mucus production and congestion that we typically have with the typical cold. So that's one clue. And then super specific symptoms or features of COVID-19 would be the loss of taste or the loss of smell.
Well, Dr. Tong, what you do and others at Doctor on Demand is so important. Telemedicine is here, and it's definitely here to stay. So thank you for helping so many people who are afraid to go to the doctor's office, who really need that convenience of being able to call in. You're doing a great job, and keep doing it.
Thank you so much. Really appreciate it.